Welcome to my capstone presentation. This presentation connects my public issue with my development as an educated citizen. Throughout my time at Nebraska Methodist College, I have grown in my ability to reflect, communicate, and advocate. These skills directly relate to understanding and addressing stress. My experiences in clinical and community settings have shaped how I view stress and overall health. Stress is a major public health concern that affects mental and physical health. Elevated cortisol, the body's primary stress hormone, contributes to problems like hypertension, immune suppression, depression, and anxiety when elevated to large levels. In nursing, understanding stress not only supports patient care, but also helps prevent burnout among healthcare workers. As someone who has experienced stress personally and professionally, this topic holds deep meaning for me. Recognizing stress early can help communities prevent long term complications linked to chronic cortisol elevation. I chose this issue because stress is something that touches every person, yet people often don't recognize its impact until it leads to major health or emotional problems. In both nursing and public health, catching stress early is important because it can help prevent chronic illness and improve quality of life. I have personally struggled with the mental health battle of stress, and I feel that it helps me to recognize it more easily in my daily life at home, work, and school. As a nursing student and a certified nursing assistant, I see every day how unmanaged stress affects patients, families, and even healthcare workers. These experiences have made me more aware of how serious stress can be. Understanding stress and cortisol also helps me reflect on my own well being and encourages me to advocate for better support systems within the community. The demographics of this issue. So, the Nebraska overview: Nebraska ranked the least stressed U.S. state in 2025, but stress levels vary by population group. Population context: Omaha and Douglas County have the largest concentration of Nebraska's urban population, which experiences greater social and economic disparities. Community stressors differ between rural and urban settings, emphasizing the need for targeted local interventions. These demographic patterns show that while Nebraska appears low stress overall, pockets of high stress remain, especially where social determinants like income, housing, and healthcare access limit resilience. So, the scope of the issue: nationally, 3 in 4 adults report at least one symptom of stress each month. Chronic stress raises cortisol levels, contributing to long term health problems such as anxiety, hypertension, and immune suppression. In Nebraska, local disparities highlight the link between social inequities and physiological stress responses, connecting this issue to overall community well being. In Nebraska, stress differences among communities suggest that targeted efforts could reduce long term health burdens. Addressing stress early can also support healthier coping skills, resilience, and overall well being in both individuals and families. At Nebraska Methodist College, they emphasize the educated citizen model, which includes being a reflective individual, an effective communicator, and a change agent. These 3 areas guide how nurses think, interact, and advocate for others. My experiences in courses, clinical practice, and community work have helped me grow in all of these roles. This model shows that nursing is more than clinical skills, it also requires self awareness, interpersonal connection, and ethical actions. Each of these roles has helped me approach stress as an issue that affects not only individuals, but entire communities. My effective communicator experience number 1 was vision screenings. So, we had the opportunity to do vision screenings for students at 2 elementary schools. A large majority of the students did not speak English as their first language. Also, children in general tend to have shorter attention spans and don't always do what they're told. I learned that communication requires flexibility, empathy, and creativity. This is especially important when verbal communication isn't possible. Nonverbal communication and emotional intelligence help build trust quickly. Throughout this experience, I relied mostly on facial expressions and gestures to communicate with the students. Managing communication across cultural and languages differences is a skill that can reduce stress in Nebraska. Programs like Stress Free Schools could use simple, inclusive language and visual tools to teach coping skills and mindfulness. My effective communicator experience number two. So, during my preceptorship, I cared for a post surgical patient who had just learned that her condition would cause permanent physical limitations. She was left without most of her bowel and would have to live with an ostomy for the rest of her life. Shortly after receiving the news, she became extremely emotional and expressed thoughts of not wanting to live anymore. At first, I didn't know what to say and worried about saying the wrong thing. However, I knew it was important to remain calm and supportive. I learned that effective communication in crisis situations requires composure, empathy, and the ability to listen without judgment. It also showed me how silence can be powerful when someone needs time to wrap their head around something. Sometimes patients need space more than words. I realized that my tone, body language, and patience mattered as much as I did, as what I said. Addressing stress in Nebraska communities requires similar communication skills. Programs like Calm Corners could train staff and volunteers in active listening and crisis communication to help individuals who feel overwhelmed by stress. The ability to respond with empathy, validation, and a calm presence can de escalate emotional distress and build community trust, which are key components in reducing chronic stress and its physiological effects. My reflective individual experience number one. I called my first rapid response while at work in October of 2023 while working as a CNA. I was caring for a patient with dementia. He had poor eyesight and limited hearing. I was his one to one sitter, as well as the sitter for the patient next door. I had just stepped out of the room after rounding on him when I heard a loud crash and ran back into his room with a colleague. He had tripped on his overbed table and fallen. He had a bump on his head, so we knew he had hit it on something. I pushed the rapid response button to get help. I learned that reflection helps me process my guilt and fear, turning it into professional growth. I learned the importance of being prepared, being honest, and staying calm under stress. This relates to my public issue because reflection can help community members manage stress more effectively. Teaching self awareness techniques like journaling or mindfulness in schools could help lower cortisol levels and improve resilience. My reflective individual experience number two. During one of my days at work as a CNA, I cared for a woman who had undergone multiple hip surgeries and was experiencing complications. She was in pain, frustrated, and emotionally exhausted from the long recovery process. Throughout the day, I noticed that while I was completing my physical care tasks, such as monitoring vital signs and helping with hygiene, she seemed closed off and discouraged. At first, I focused primarily on managing her physical needs, but I began to realize that she also needed emotional support. I took some extra time to talk with her and listen as she shared how overwhelming her situation felt. Simply giving her the space to express her feelings helped her relax and open up more. After our conversation, I noticed she seemed calmer and a lot more at ease. I learned that being a reflective individual requires taking a step back and thinking critically about my approach to care. Reflection allowed me to see that focusing only on physical tasks can sometimes overlook the emotional side of healing. It helped me understand the value of slowing down, being present, and providing compassionate listening as part of holistic care. This connects directly to my public issue of stress and cortisol levels in Nebraskans. Just like my patient was affected by both physical and emotional stress, people in the community also experience the same connection between mental well being and physical health. Encouraging reflective practices in schools and community programs like stress free schools or calm corners could help Nebraskans better manage daily stress. My change agent experience number one. So during clinical, I had a patient who spoke limited English and didn't fully understand her new insulin regimen. I advocated for an interpreter to ensure she understood the changes to her care. We were able to get an online translator to communicate the patient's concerns and questions as well as our education. With this experience, I learned that advocacy and small actions can create big change. Nurses must address cultural and communication barriers that cause inequities in patient care. This experience showed me how systemic barriers contribute to stress for certain populations. Advocating for fair, understandable healthcare supports not only physical health but emotional well being. Reducing cultural and language barriers can help decrease stress in high risk communities. Stress levels are often higher in marginalized groups due to systemic barriers. Advocating for equitable access to mental health services can also help reduce chronic stress. My last experience being a change agent, during my shift at preceptorship this semester, an elderly man was preparing to take his wife home from the hospital. His wife had advanced dementia and recently been started on tube feedings, which he would be responsible for managing at home. As the nurse gave the discharge instructions, I noticed the husband nodding along but was visibly overwhelmed. He did not ask very many questions. It was clear to me that while he wanted to look confident, he might not fully understand how to safely perform his wife's feedings at home. I raised the concern that the husband might need more hands on teaching to the nurse. I respectfully suggested that we review the tube feeding process step by step with him and allow him to demonstrate the procedure before leaving. I learned that being a change agent means slowing down, recognizing when others are struggling, and advocating for additional support to benefit the patient and their caregivers. Similarly, Calm Corners would give adults the tools and safe spaces to manage stress and build their confidence through education and support groups, which in turn would help them regain control of their health and well being. My conclusion: throughout my journey at Nebraska Methodist College, I have grown into an educated citizen. This includes being a reflective individual, an effective communicator, and a change agent. Each role contributes uniquely to addressing stress and cortisol levels in Nebraskans. Reflection builds awareness for the future and emotional control. Communication boosts trust, and advocacy enacts real community change. By applying these skills, I can help create community environments that reduce stress, improve coping, and promote long term well being. As a future nurse, I hope to start support programs and conversations that help Nebraskans reduce their stress and improve their overall health. And here are my references. Thank you for viewing my capstone presentation.